Go back. Welcome back, everyone! Welcome back to the Morning After Show, the show where we talk about the magic, the tragic, and everything in between. My name is Sharvin. Yes, I am underpaid. On today's show, we will be looking into yet another young woman's life that took a turn for the confusing a few months ago. Take a look.
Hi, my name is Meara. I'm 26 years old. Not too long ago, I was in a 4-year abusive relationship with my college boyfriend. It was a really harrowing ride, but I managed to bring myself to break up with him about 2 months ago. And not long after that, I met the love of my life, Daphne.
Hi.
It's a little unconventional, but it is what it is. A few weeks ago, I realized that my period was really late, pretty much a month late. So I went to get myself checked and found out I was pregnant. It was so shocking and terrifying because I come from a traditional Asian family, and having premarital sex is one thing, but to be pregnant, that just terrified me. Like, what would I say to my parents, But things only got scarier when I went for my antenatal screening, and the doctor told me I had syphilis. He said that I've had it for a while now, and, well, my biggest concern is how is it going to affect my baby?
Please give a warm welcome to our guests, Miss Meara and Ms.Daphne. First and foremost, I would like to say thank you so much on behalf of the show for coming out about your situation and help normalize, 100 people who might be facing the same situation as you. So without further ado, let's get into it. Please give a round of applause to our expert residents, Dr. Janelle, Dr. Naila, and Dr. Sonia. Dr. Janelle is our resident medical expert, Dr. Naila is a resident psychologist, and Dr. Sonia is a resident sex therapist. Please give a round of applause to these ladies. So, Meara, Daphne, this is our resident smartass, Miss Janelle.
Hi. Hi. Thanks, Ravi. By the way, yeah.
So, Dr. Janelle, can you shed some light on Miss Meara's situation here?
Well, syphilis is a well-known bacterial infection that transmits via infectious lesions of the mucous membranes. When I talk about mucous membranes, I'm referring to places like the mouth, the anus, and the genitals. So that's where syphilis can transmit to and from. So also, like when it comes to mucous membranes, we're talking about body fluids. So of course, sex is the main form of transmission for syphilis. But then at the same time, you would have to take into consideration other forms of transmission that are less well known. One would be blood transfusions, whereby the person gets in contact with the contaminated blood. So the second one would be like non-sexual contact, such as kissing. As long as there's an exchange with saliva, that's when syphilis can be transmitted. Lastly, there is also the mother-to-child transmission during pregnancy, because there is an exchange of body fluids, or nutrients or rather, from the mother to the child via the placenta. Yeah. So, Miss Meara, do you have any painless sores in the vagina by any chance?
Not really, but I did notice a small area of my vagina that did bleed and was painful for a while, but it did heal though.
Actually, that's a very common symptom for early syphilis, unfortunately. It's normally called people know it to be painless sores, but in medical terms, we call it the chancre. So most people don't actually notice about the chancre in the early stage. So unless it ulcerates, which is what you have experienced, technically the chancre would only appear roughly 3 weeks after the incubation period. So this means, when I say incubation period, I mean when you're exposed to the bacteria that causes syphilis, which is basically the Treponema pallidum, or what we call the T. pallidum.
Very enlightening, Dr. Janelle. Ms.Daphne, do you have any questions for Dr.?
The first question I would like to ask is it curable?
Yes, it is. According to, as recognized by the WHO and researchers worldwide, the most effective treatment for syphilis is the benzathine penicillin G, in short BPG. It is an antibiotic. So it really depends on the stage of syphilis. So the earlier the stage, the shorter the treatment duration, and the better you're done with it lah.
Oh, well then I guess it's safe to say that it's a really good thing that you've been diagnosed at such an early
Wait,
stage. Yeah.
but once the syphilis is gone, will it be cured forever?
That's the thing. The common conception is, the common understanding is that once you take any antibiotic, that's when you're immunized against that bacteria or virus for at least a long time. Unfortunately, for BPG, BPG does not in any way eliminate nor reduce the likelihood of reinfection.
Coming back to you, Miss Meara, I know this is a really hard time for you. Do you have anything to say about it?
To be completely honest, I feel really ashamed. I feel my family and everything they thought me to be. You know, having an illegitimate child is embarrassing enough. But to come out with an STI, I can't help but feel depressed about it.
So, Dr. Naila, what do you have to say about this?
I would say that it's understandable how you're feeling, but you see, this shame and doubt and embarrassment is something that every woman go through, and it's very common, mainly because of how society has constructed how a woman should be, you know. And there are gender roles already given to male and female because of this double standard that society has created, and where a female is told to be more towards pure and to be sacred and not to be sexually active before marriage. But then for a man, it's more of a easy task where they have multiple sex, they are still not judged, and they are considered to be more sexually active, and it's something normal for them, and that men go with their instincts. It's something that society has labeled for both genders, so it makes it hard for a woman to actually be sexually active. So you see, Meara, you shouldn't feel yourself, you shouldn't put yourself in this situation and make yourself feel more and more bad about it. It's because this is what society has made, you know, for a female to feel. And I feel that in recent generation there is more of rising feminism, and there is more acceptance, and there is more rising feminism. So the thing about liberality is that the new liberal principle talks about how a woman can have a free way of making decisions and to be responsible of whatever decision she has made.
When it comes to sex,
yes, when it comes to sexual situations. But the limit to this new liberal principle is that it solely tells a woman that she should be in control of the situation she was in. And for example, when a woman accidentally gets pregnant, or she has STI, they suddenly tend to label or judge the woman very quickly. So that's still present. So you see how society works, right, Meara? So you shouldn't put yourself down because of all these consequences, and because it might lead to a lot of stress for you and for your child. So I would,
Yeah, true. And the liberal law, like you said earlier, right? I'm just paraphrasing. Says that you're free to make any sexual decisions as long as you accept the consequences that comes with it. Yeah, that's a lot of pressure on a woman right there.
I'm assuming that like when a woman is criticized when she is pregnant or she gets an STD, people criticize her for not being in control. So
That's true. That's true.
So that's when the sexual stigma is still there.
the stigmatization is still
being
lingers.
sexually active, and on top of that, you're expected to be in control. Am I right?
Yes.
Yeah, that makes a lot of sense.
Miss Meara, you mentioned that you feel like you've disappointed your family. Have they expressed that to you?
Well, yes, they actually cut contact with me when they found out I was pregnant.
Oh wow.
And so the only person I have now is Daphne.
I feel having a support system
will be much more beneficial for both of you because since you said you are not having that family support, right? So I feel like having a support system will be really beneficial.
Wait. Why does she need anyone else? Am I not enough?
No, it's not that you're not enough. It's very understandable that you both are being together is a really understandable thing. But you see, a romantic relationship will have some sort of interdependence. And when I mean interdependence, they have this sharing of activities, stressors, and outcomes, and especially the expectations you both have for each other. So when one of you might cope up with these expectations and stressors and all that, it might affect the adjustment of the other. So I personally feel that it might really deteriorate the relationship between you both because I feel, Daphne, that you might undergo a lot of coping stress problems and difficulties, and you might push aside your own needs and your own opinions aside, and you might put Ms. Meara's problems as your priority, and that might really stress you out and strain you, and I feel like that will really deteriorate the relationship between you both. So I feel personally that having a support system is really beneficial for both of you, and it will really help guide you both, in a better way.
So, Dr. Nala, on top of emotional burnout, there is also unfulfillment of sexual needs that needs to be considered because when one's sexual need is not fulfilled, it tends to cause one to have really low self-esteem. And when you have low self-esteem, it decreases sexual expression, where you become really timid to express yourself towards your partner.
Yeah, there's suppression of the emotions.
Yes.
They don't tend to open up.
Yes, and this could lead to sexual anxiety. And this is not healthy for good relationships because sexual satisfaction is really important to maintain a long-term and a very happy relationship.
Yeah, that's why I feel like having an external support system is really important because when you need a certain advice from someone, it's better to have certain others who you trust, so you can easily have an opinion and how they can help you in some ways to guide and negotiate your roles and whatever responsibilities to make your relationship a bit more better too, and because it won't create the stress and that strain between the two of you,
Yes.
So it's a better option.
True.
I feel.
And to add to what Dr. Nal has said, from my perspective, I would say that it's good to have an external social support system so that you would have a set of support strategies to draw from when it comes to confronting problems. And in a way, it does reduce the likelihood of getting mental conditions such as depression, as you would know, which pregnant women generally are more vulnerable towards getting.
Yes.
And overall, it's also better for the health of the baby because then depression is actually strongly related to pregnancy complications such as having babies with low birth weight, giving birth to premature babies, as well as miscarriages, and also probably spontaneous abortions. So in a way, having an external social support system is actually very beneficial for Ms. Meara as well as Ms. Daphne.
Thank you so much for that enlightening discussions, Doctor. Dr. Sonia, in light that such burnout is to occur between our two lovely couple here, what would your advice be to them?
According to my professional opinion, is both partners need to be very open towards expressing each other's feelings, which makes it very important to communicate with each other. So first and foremost, you start off with the I statements. I statements allow each partner to be vulnerable towards each other, as in both partner knows that you're expressing everything you feel towards me, which invites me to create a more receptive and sensitive response. Yeah. Secondly, communicate on the behavior instead of instead of interpreting one's behavior and saying it to your partner. I'm just going to give an example here. So, for instance, when your partner does something that dissatisfies you, for example, your partner doesn't go to the hospital to get treatment. So instead of saying you are very irresponsible for doing so, You say, I noticed that you did not go to the hospital to get your treatment done. You see, those kind of behavior, the difference between that is, one, the partner might feel like you're accusing them. Second, they feel that, oh, you're telling me that I should do that in a very nice way, so I understand that. So that's important too. And third, whenever this kind of dialogue occurs, right, limit it to just one concern at a time. Do not go more, because your partner might feel very accused and form a very defensive statement there. So yeah, they might also feel very overwhelmed to respond back in a nice way, so that might cause like friction, strain the relationship and so on. So these kind of tips, although they may seem small, they are very important to facilitate an effective relationship, an effective communication system between the partners. And this also reduces defensiveness, which we all know causes frictions and so on. So lastly, whenever you have negative concerns that you want to express towards your partner, make sure to accompany it with praises, right? Because a concern is already something negative, right? So what you do is that you accompany it with something nice, like a praise, so that your partner feels appreciated. Like a partner doesn't focus on the negative concern that you tell them. So yeah, so communication is definitely something really important, and you should consider all this to have a very effective communication life in your relationship.
So basically, you say that I appreciate you as a person, and then you go on to explain about the concern.
Yes. Everything comes second. It's your partner that comes first, and I'm telling you, we are very expressive towards each other.
Yeah, it kind of
Yeah.
gives a good flow between the two
Yes,
partners,
yes, yes,
right?
it
Conveying
does.
their-
So it's
That's certainly something to think about. Thank you, Dr. Sonia, for your input. Before we end our show today, we're going to have a short Q&A session where our guest and our audience members will be able to pose questions to our professionals. Ms.Daphne.
Yeah, I have a question for Dr. Janelle.
Sure.
Okay.
You mentioned before about the congenital syphilis. Can I know how serious it can be?
It is actually very serious, because as long as the mom has untreated syphilis, the baby getting syphilis is actually inevitable. So, and what's problematic about congenital syphilis is that most infants that are born do not actually manifest symptoms immediately upon birth, but they actually manifest symptoms only months to years later. So by then, things may have become, quite bad.
Thank you, Dr. Janelle. Joining us now will be one of our audience member who will come and ask questions for the Q&A portion. Hello, introduce yourself.
Hi, I'm Shalene and I have a question for Dr. Janelle.
Yeah, sure.
So what if the person has penicillin allergy? Can they still be treated?
Yes, they can. The first step that the doctors would do would be to try and desensitize the patient first to see if he or she has the possibility of being treated. So if he or she is successfully desensitized, then you can treat with penicillin. However, if this desensitization technique does not work, then there are other alternatives, of course, which are antibiotics. There are two roughly. One would be ceftriaxone, the other one would be doxycycline. Generally, doxycycline is used because it's cheaper and you can take it orally, whereas for ceftriaxone, it's normally via injections. Unfortunately, doxycycline cannot be used on pregnant women. So, for pregnant women, apart from ceftriaxone, there is another option which is more commonly used, which is erythromycin. The downside to erythromycin is that erythromycin cannot cross the placenta, which means that if the mom has syphilis, there's a chance that the syphilis bacteria would cross the placenta to infect the child, and the erythromycin will only treat the mom but not the child, which means that upon birth, the baby will need to be treated separately with penicillin. So that's the downside lah. So ideally speaking, penicillin would be the best treatment option in general.
Okay, thank you, Dr. Janelle. I have another question for Dr. Sonia. Does condom prevent STI, and how do you actually use it properly?
Unfortunately, condoms do not prevent STI, neither does other contraceptive methods, except for abstinence. And the best you could do is to get yourself and your partner treated, and to see all the symptoms and the signs of STI, so that both of you can get tested for it. And to further answer your question on how to use a condom, I'll now demonstrate how to use a condom. So today I have Charlene, one of our audience here, who asked me about how to use a condom. So I'm going to ask her a favor to help me demonstrate how to use a condom. So here we have a cucumber to represent a penis, an erected penis. And here we have the condom box. So Charlene, can you hold for me the penis like this? Yeah. So this is to demonstrate that this is an erected penis, right? So this is the condom box. So some people just take a few packs and just leave it in your bag, right? So you see, there's an expiry date here, so you don't have an excuse that you can't see the expiry date. It's right here, June 2022, right? So when you put your condom in your pocket or in the dashboard or in your wallet, just make sure you don't put it for too long, because if you put it for too long, it might erode. I mean, it's not like you can't put it, just don't put it for too long under the heat. Alright? Okay, and when you're using a condom and when you're having sex, right, make sure you don't use in oil-based lubricants. Use a water-based lubricants, because oil-based lubricants tend to cause erosion to the condom and it might cause defects on the condom. Right. So here's the place to tear. So tear it properly, do not bite it, and make sure your sharp nails do not pierce through it. Yeah. So open it up, and here you have the condom. You see the tip is facing here. Make sure this is how you hold the condom. Yeah, the tip needs to be facing on top. So while you're putting, before you put the condom on the penis, make sure there's no defects on it, and make sure to put it on an erected penis. Yeah. So start now. You hold the tip. You're holding the tip is because you don't want to form any air inside. You want to leave some space for the sperm. Once it's for the semen, once it's ejaculated, you want to leave some space, because if you don't leave any space, right, once the male ejaculates, it's going to cause like pressure, and the sudden pressure will cause like the condom to break again, and it cause any defects. So here you go. We are slowly going to push it down while holding the tip. Yeah. Yep. Pinching it. Yep. Just make sure you're holding on the pinching it on the top and push it slowly to avoid any air bubbles. Yeah. So just gently press down all the air bubbles to go out. Yeah. And then we got that? Yeah, we got that. Alright. So here you go. So once you have done sexual intercourse, have sex, when you wanna withdraw from the vagina, make sure you hold the base of your penis here, and hold your condom too, so that it doesn't slip out when you're taking it out of the vagina. So you hold it here and you slowly withdraw from the vagina, and then you can take it out. Yeah. Once you take it out, just make sure do not reuse the condom, because it's not to be reused, and it's very unhygienic. It's just very hygienic. And yeah, that's all we have for our demonstration today.
On that note, we have reached the end of our episode. We would like to thank our professionals over here. Give a round of applause to Dr. Janelle, Dr. Meara, and Dr. Sonia. And of course, thank you so much, Miss Meara and Ms.Daphne. Your story will definitely help millions out there, and thank you so much for being so candid with us.
Thank you so much for your time and effort.
Thank you. But don't thank me just yet, because we at the Morning After Show, we really believe in supporting people who come out and speak of their problems in a world that, put so much stigma on these kind of issues. So we at the show would like to offer you a free BPG treatment to help you cure your syphilis. Everyone!
Oh my god!
Thank you so much.
No worries. And that's it for us, folks. Join us next week on The Morning After Show!